Dr. Lucie Bianchi, and you are at Mindful MediSpa and MediClinic. And today I have one of my very good friends with us. This is Dr. Sean Palmer, and he is a very popular orthopedic surgeon in the general Chicago area. And in case you didn't know, that includes being board certified and fellowship trained at the University of Chicago. And he's also a lifetime member of the University of Chicago's Surgical Society.
That's correct.
Can't say that 5 times fast, can you? So you like to do hips and knees.
That's all I do, yes.
Okay. Why is that all you do? Tell us how you got into that.
Well, it just became what I enjoyed the most in residency. Those patients come in broken and you fix them and they move on with their lives. And so it's a tremendous relief of both their pain as well as their disability. And it's a very highly successful surgery. So you have happy patients, which is fun for everyone.
So what does it mean to be minimally invasive with a joint replacement?
It meant a lot more 10 or 12 years ago when the pathway became mobilizing patients quicker, getting them out of the hospital faster, and smaller surgical approaches. Honestly, it's the way almost every surgeon does it now.
Okay, so if a surgeon's not doing a minimally invasive procedure, that's probably a really old trained surgeon or someone who's not keeping up with the times?
A little out of date, correct.
Okay, alrighty. And then how do patients know their endpoints, know that they need to have the surgery? Is it something that you can see on an x-ray? Is it something that you guys decide together?
It's actually multiple factors combined in that it's very individualized what any one patient can tolerate. And I can see a patient with a horrible looking x-ray who really has minimal pain, and maybe they're there because their wife got tired of watching them limp and sent them to the doctor. But he'll tell me, it really doesn't hurt that much, I'm fine, and I don't recommend surgery for that person. On the other hand, I've seen patients whose x-rays aren't the worst I've seen, but they've been through every conservative treatment imaginable, and they're darn near disabled. They're having trouble working and having trouble with just their daily lives, and those patients have surgery.
Okay. Now, a lot of our patients and our members here are really minded for prevention. They don't want to get to the point where they're going to need surgery. So what kind of advice would you have for a normal, healthy adult? How do you prevent getting to a point where you need a joint replacement?
Well, in terms of degenerative arthritis, the most common predictive factor is genetics, and that works against you no matter what your lifestyle is. Some people are just predisposed to the hips and knees going bad at the different ages. But as you know, you can be very surprised how much a healthy lifestyle fixes everything. Mm-hmm. So you can prevent not just your hips and knees from going bad, but diabetes and heart disease and other things that can befall us when we make bad healthy choices. And so a healthy lifestyle, maintaining an optimum body weight, and then really exercise appropriateness is very important, especially as we get into our 30s and 40s. We have to protect our joints when we exercise. So I counsel against the men doing, deep squats at age 50. You got to stop your joints at 90 degrees. Be careful how you run. Running on your forefoot instead of with a heel strike makes a huge difference, not just in your hips and knees, but also in your back.
Now, what about those people who are interested in endurance activities? They've become really popular over the last, say, 10, 15 years, like not just marathons, but people who want to do 50 marathons before 50, or people who want to do ultra marathons. What sort of advice would you have for them and their joints?
Well, life is meant to be lived, so I don't ever counsel anyone to not do an activity, but at the same time, there's really nothing in life where it's no pain, no gain. So when something hurts, you have to modify either your training or modify what your activities are.
So I guess what you're saying is if somebody really enjoyed running and wanted to do marathons or more than one, as long as they weren't getting injured and their body was tolerating that kind of activity, they might be okay?
Correct, but even for things such as the Chicago Marathon or the Boston Marathon, if somebody has an underlying condition that's painful, but they really want to do that race, I tell them all the time, your hip and knee pain is not chest pain. Nothing dangerous is going to happen if you push it a little bit because you have the specific activity you want to do. So I tell them go ahead and train, and you can take care of the aches and pains afterwards as well.
Yes, there are many, many aches and pains, I know, from firsthand experience. I want to kind of shift gears here to more prevention stuff with that. So for someone who's not into endurance activities, what type of exercise would you say? How much exercise does someone need to do? How many days a week? Do you require weight training?
It really kind of depends on your preference and what you enjoy. I find that when I have time, I go to the gym every day if I can. Is that too much? Well, you have to listen to your body. If you start to overtrain, Do you start to feel more fatigued than you should? Are you not getting the other benefits that you have? Are you not enjoying it? Are you finding it that it's becoming a chore? Then you're probably overtraining. So it's a balance between what you enjoy and then what you have time for.
Right, okay. I think I would agree with that. I usually tell my patients, everybody has a pair of sneakers. We can all walk. And at the very least, we can do that. You have to do that to get from point A to point B. So it's not really exercise if you think about it as a mode of transportation.
Right, and something is always better than nothing.
Absolutely. All right. Now, a lot of our patients are interested in supplements, and I have a lot of patients who ask me about turmeric and whether or not that's going to either help their joint pain and or keep their joint healthy to put off some of these things we've been talking about. Do you have an opinion about turmeric?
My general opinion for all supplements is, first, make sure that it's harmless. And if something is harmless, how does it work for you as an individual? There aren't very good randomized studies in terms of how a supplement works, but I've lost track of all the different things my patients tell me make them feel better. So if something is harmless and you use it and you feel better, then go ahead.
Okay, so you're kind of pro-supplement as long as it's not dangerous.
Correct.
Would you say the same thing for glucosamine? There are some studies, I think, on glucosamine.
There are some, most of them are in the animal model. There are some in human studies that show that it has some benefit, but again, it really is more of a food product. It is absolutely harmless. It doesn't interact with any of your prescribed medicines, and I have patients who tell me it makes a tremendous difference, and so I recommend that they take it.
Okay. And then what kind of a healthy diet do you advise for your patients, or is that also kind of just whatever they like to do?
Well, I try to give patients advice based on my own experience, and so dietary is where I kind of falter a little bit. I don't tend to behave myself very much with that. You find that you really can, if you exercise appropriately, be a lot more liberal with your diet, and as long as you have the care of a good primary care physician, and you don't have issues with your blood pressure, your cholesterol, what your triglycerides are running, then there's different diets that may be good for you that aren't necessarily right for someone else.
And that is kind of what we talk about here too. I keep a whole library of diet books because I think that one way of eating doesn't work for everybody.
Sure.
If you hate steak, then you're gonna have a hard time doing a protein diet because, beef is a lot of it.
And when you have a new diet coming out almost every year, that tells you there's no one perfect diet. We would have discovered it already.
Right, yeah. And actually, interestingly, so many of these diets, when you really kind of look at them, they're all kind of a variation on the same theme. Eat lots of fruits and vegetables more than fruits, and include a lot of protein. And that seems to be kind of all the latest and greatest is kind of what they're doing, which, however it's going to work is how it's going to work. So now you mentioned that you're not very good with your diet, so maybe you could let everybody know, what is your guilty pleasure? Where are you falling short? Maybe it's the place where I'm falling short or where my members are falling short.
I don't even want to admit it, but at my house we fry everything.
So if you're gonna have a cheat day, it's gonna be in a deep fryer. Okay, well I think that probably most Americans would probably fall short in exactly that way. So no sweet tooth.
No, not me.
Okay, well that's good. If you only have a guilty pleasure or a cheat day in one area, if you kind of like everything, then it becomes a little bit more difficult.
That's true.
So it sounds like you like to lift weights.
I do.
And then what do you do for cardio, or it's just strictly weight training?
Well, I actually do, I do circuit training, so I try to lift weights as fast as possible. And I find that I get my heart rate up pretty good. And so the entire circuit takes me a little under an hour, and I'll maintain a heart rate of at least 120 for that entire time frame.
Oh, okay, well that sounds really good. And are you working for a competition, or you're working for yourself? I
just enjoy it. I was an athlete in college, and it just became a lifestyle for me, and I've been able to keep it up, and I just turned 50 last year. So.
Oh, well, happy belated birthday.
Thank you.
Have you noticed big changes in your endurance and strength with that, or not
really?
Yet. Well, good for you. I'm close to that, and I haven't either. So as you know, here at Mindful, we're super interested in helping people get a healthy lifestyle, trying to give them the right information about joint health and answer some of their questions. What is it that you might offer one of our members if they sought your care because they were having some joint difficulty?
What I've tried to transition my practice to, as a joint replacement surgeon, most of my patients come to see me to get a new hip or knee. And I try to provide an extra service while they're there of going through the medical history, what medications are they on, and what things do they enjoy in life. If somebody tells me that they're not being able to play tennis for 10 years, but they would like to, well then how do we start that process to regain the strength and the endurance after your surgery to get back to that level of activity? How do you then incorporate diet and exercise into a more healthy lifestyle so that you can better enjoy the new hip or knee?
So you're doing really comprehensive. You're not just putting the knee in, you're also giving them a handbook, so to speak, of, and this is how you take care of it so you never see me again.
Correct.
I'm sure they appreciate that. Now, with all of the advances in technology, if someone gets a knee replacement or a hip replacement today, how many years does that typically last?
Well, there's actually some very good outcome data recently that shows about 22 years is the average for both a hip and a knee.
That's great.
And we've also seen a revolution in data where it's been the dogma for a very long time that the more active you were, the faster you'd wear out your new joint. So people were told to be cautious. We have excellent studies that show that you can perform up to your own athletic ability without any concern of wearing the joint faster. So I have patients who play ice hockey and who snow ski and do martial arts and a full range of activities, and they can do that without the fear of wearing the joint out faster than they otherwise would.
Well, that sounds great. So it's very possible that they could just get one joint replacement and not have to have it replaced, say in 10 years or 15 years, unless they're exceedingly unlucky.
Correct. Now, there are variabilities from patient to patient. Certainly individual results can vary, but when you look at the entire spectrum of joint replacement patients, it's over 20 years.
Sure. But for those that are really active and want to remain active, that's still really good news.
Yeah.
Is there anything that you think that our patients would want to know, or that you see them asking you a lot, that seems to be like maybe a great myth out there about joint health?
I think the great myth in terms of what I do is what the experience is like. Now, again, surgery is very serious, and I've had surgery myself, and it's a scary endeavor to undertake. But what patients are surprised to find out is that it's not a 3-hour operation followed by 6 months off work and a year-long recovery. It's a very set process where, the operation is about 20 minutes. You now go home that day. You're back at work in 2 weeks. And that's not to minimize the fact that it's a very serious operation, but at the same time, the impact on your life in the short term is small for the long-term benefit of a tremendous reduction in both your pain and improvement in your function.
Well, that sounds great. Kind of makes me want to get 2 new knees. Only I think mine are still pretty good. Well, thank you, Sean. You've given us a lot of great information. Do you think you could come back and talk with us about other orthopedic injuries?
It'd be a pleasure.
We'd love to have you back. And thank you all for listening if you're still listening. And we will have many more videos about orthopedic injuries, joint health, and other types of things for the summer. So give me your questions and give me your thoughts, and we will try to make sure we incorporate the types of things that you want to hear next. Have a good afternoon and keep exercising.